Well, good evening and welcome to the COVID-19 update. I'm Kayode Okikulu. Here are the highlights. Ogun State COVID-19 Task Force apprehends and prosecutes residents flouting non-pharmaceutical measures in the state. Delta State government prepares for Warri Airport opening within weeks and promises ambulance for evacuation of sick travelers. And proceedings in the European Union's case against AstraZeneca begin. The Union is accusing the vaccine maker of delays in delivering doses. Well, if you thought the COVID-19 battle was over, you might need to have a rethink, especially with the latest infection figures from the NCDC. In the last 24 hours, Nigeria recorded 156 positive COVID-19 cases. Now, on the face value, that is an over 300% increase from what the NCDC recorded just a day before. And by the way, the last time the daily cases were this high was over a month ago on March the 23rd, when the nation recorded 214 new infections. But there's a story behind this recent spike. That's in a moment. Meanwhile, Nigeria continues its vaccination drive, championed by the National Primary Healthcare Development Agency, incidentally at a time when the world is commemorating the World Immunization Week. But at this rate, with a global drive for vaccination and hopefully eventual immunization, you might just call it World Immunization Year.
An additional 156 coronavirus infections have been confirmed in Nigeria, a rise from the 37 infections recorded in the previous 24-hour cycle. The new infections were reported in 10 states and the FCT. Lagos had the highest figure with 50 cases, closely followed by Enugu with 43 cases and Adamawa with 40 cases. According to the NCDC, the latest report also includes data from Enugu State recorded on the 20th to 26th of April and cases from Adamawa recorded over a period of 2 weeks. 8 infections were reported in the FCT. Ogun recorded 5 cases. Akwa Ibom and Plateau States had a record of 3 cases, while Jigawa, Kaduna, Oyo, and Rivers recorded 1 infection each. The latest tally has raised the overall count of confirmed cases in Nigeria to 164,912. The agency reported 1 death from COVID-19 complications in the last 24 hours, raising the fatality toll to 2,063. 49 people have been discharged after testing negative in the last 24 hours, bringing the total recoveries in the country to about 155,000. According to the NCDC, Nasarawa, Ondo, Lagos have the highest number of cases currently on admission, while Niger, Cross River, Kogi, Sokoto states have recorded 0 cases on admission. Almost 60% of Nigeria's targeted population have now received the first dose of the AstraZeneca vaccine, according to the latest update by the National Primary Healthcare Development Agency. The World Immunization Week campaign is still on, and the NPHCDA is advising Nigerians to prioritize vaccination as it remains the only tool against preventable diseases. Over 4.5 million confirmed cases and more than 120,000 deaths have been reported in Africa, while more than 148 million cases and over 3 million deaths have been recorded globally.
Well, the Ogun State government believes the domestication of safety protocols with special task forces for enforcement in all the 20 local government areas in the state is responsible for the reduction in daily COVID-19 cases. The State Commissioner for Culture and Tourism, who also doubles as a chairman of the Special Task Force on COVID-19, Mr. Taiwo Oluwatoyin, adds that the state is not out of the woods just yet and asks residents to take responsibility for their health by keeping to the laid-down safety measures to reduce the spread of the pandemic. While condemning the current non-compliance among residents, the State Commissioner also called for a change of attitude. With yesterday's 5 new infections, the state has now recorded 4,656 cases in total, with 49 fatalities.
What we did was just to create more awareness all over the state. And after the exercise, we try and domesticated it in all the 20 local government. So as we speak, we have task force, COVID-19 task force in all the local government. And they're carrying out their exercises. And anybody that is apprehended will be taken to the court of law in that jurisdiction. It was only for that exercise that we went out with the mobile court. But that's why you see that the number has reduced drastically.
Elsewhere, flight operations are expected to resume at the Osubi Airport near Warri, Delta State in a few weeks, and that's after it was shut down in February last year. The state governor, Dr. Ifeanyi Okowa, says that talks are ongoing with the management of the Federal Airport Authority to ensure that the airport resumes flight operations as soon as possible, while giving an assurance that adequate steps have been taken to ensure that COVID-19 safety protocols are strictly observed before the full resumption of flight activities. Seats and the lobby have been carefully marked in accordance with the guidelines as stipulated by the health and aviation authorities. Governor Okowa was speaking during the inauguration of some project in Efero by the Benue State Governor, Samuel Otom.
We are aware of the difficulties and the challenges that led to the closure of the airports. Now the federal government has resolved that FAN should begin to run that airport. The challenging situation then was that they needed the airport to be ready with all COVID protocols. I want to assure Your Majesty that this morning I was at the airport, and the special project director in charge of airports has done a great work. We released money as a state to ensure that all that was needed to make the airport COVID compliant has been put in place. And I was just informed by the director of the airport that on Monday, the NCAA will be coming in for their final inspection. And he did tell me that the only thing that may hold them back is just the fact that they do not have a medical ambulance for evacuation of any sick passenger. And I've reassured him today that by the grace of God, we will try to ensure that we'll provide them with a medical ambulance between today and Monday.
Well, in a related development, the traditional ruler of Okwe Kingdom has advised Deltans not to lose their guard as the pandemic is still very much around the corner. He emphasizes the need to continue to keep safe by observing all COVID-19 safety protocols.
The truth is that we must try and build rules in this country. Because we are not to build rules, that's why the country goes down the drain. We have to build simple rules. There you say, wash your hands, you will wash your hands. It is only God that is saving us in this country. That simple protocol, face mask, wash your hands. So social distancing, we cannot obey it. If you see what is happening in India now, it is frightening. We should not rest on our hours, please. We don't want to lose people.
Well, Dr. Oladapo Ashinyobi is a public health care professional. He joins us virtually on the program this evening just to discuss some of the recent happenings and the trends in Nigeria's battle against COVID-19. It's great to have you on the program, Doctor. Well, I mean, you just listened to the traditional ruler who says that it is God that has been helping Nigeria. I mean, looking at some of the flouting of the COVID-19 protocols. But for you, do you believe that the figures we're reporting daily, which have reduced over time, is as a result of something we're getting right, or it's just a normal phase in the life of a pandemic? Okay, Doctor, your connection is a bit sketchy, but we'll work on that just so we can get your thoughts on this, especially because you have been at the forefront of this fight against COVID-19. So we'll try to resolve that in a moment. But let's head outside Nigeria, this time at the UAE, where despite having administered over 10 1.3 million doses of COVID-19 vaccines. The UAE government says it is considering stricter measures to curb the spread of the virus, including restricting unvaccinated people from gaining access to certain places and certain services. Well, this comes as it crosses the 500,000 infection mark. Our correspondent Mayowa Adegoke has more on this.
Residents of the United Arab Emirates who choose not to take the COVID-19 jab may find themselves restricted from accessing certain places and services, according to the local authority. This warning, issued as part of its weekly COVID-19 update, comes as the nation crosses the 500,000 infection cases mark. Now the government is considering a number of strict measures, such as restriction of movement, to ensure the health and safety of the population.
So currently, the no, absolute no to take the vaccines will be those who have severe allergies, all right, to any of the components of the vaccines. We've seen some people develop severe allergies to the components. Then also, pregnant women are currently not advised to take the vaccines, and of course, children under the age of it depends on where you are, 18 or 16 are not allowed to take the vaccine. So those are absolutes. Then also for people who are immunocompromised, right? So people who may be taking immunosuppressive drugs. So an example would be people who probably have cancer.
Your hesitation today is an obstacle to our goals. It puts your family, loved ones, and community at risk, reads part of a tweet posted by the government trying to encourage residents to learn information and scientific facts about vaccines from official sources and concerned authorities. Some residents appear to be listening to this latest warning and various campaigns. Asma and Nisha voiced their doubts about the vaccine to Channels TV earlier this year.
I'm trying to just face reality in terms of, nobody knows what is the cure for COVID. We're trying to make it go away. And the best shot at the moment right now is taking the vaccine.
Fast forward 3 months on, there's definitely a lot more clarity. There's definitely a lot more knowledge, a lot more understanding of the types of vaccines that are available in the UAE and the effects of each of those vaccines.
UAE has also updated its eligibility criteria to cover persons aged 16 and above, women who intend to get pregnant within 3 months, nursing mothers with 6-month-old babies, and previously infected persons, while giving priority to people living with disabilities. There has been no word on when and if this new measure would be implemented, but it is obvious the UAE is determined to vaccinate its entire population as a means to keep its economy fully operational. Where this leaves anti-vaxxers resident in the country is yet to be seen. Mayowa Adegoke, Channels Television News.
Well, have you ever wondered what life is like in a high-burden country like Brazil? Well, after the break, we speak to a physician who is right there dealing with the deluge of cases. That's in a moment. Join us again. Welcome back to the program. Now, Nigeria ranks somewhere around 79th on the list of countries with the highest COVID-19 burden. The top 3 countries on that infamous list are the United States, India, and Brazil. Well, a lot of pictures and videos have come out of these countries showing just how dire the situation is, especially in India and Brazil. Now, that aerial shot of graves already dug for COVID-19 fatalities remains one of the grimmest depictions of the reality in Brazil. The country has the 3rd highest numbers of COVID-19 cases at over 14 million, with fatalities nearing 400,000, which is the 2nd highest in the world. So if you've ever wondered what it is like there, from caring for patients to surviving everyday life, well, let's speak with Dr. Ima Oluwatui, a Nigerian physician in Brazil. It's great to have you on the program. Over 72,000 cases and 3,886 deaths yesterday. You know, it's one thing to read about it and watch it on TV, but what is it like living there as a physician?
Yeah, good afternoon, my people. Good evening, Nigeria, really. I've been living in Brazil for the past 39 years. so it's lawfully living in this country. The question of COVID-19 in Brazil is a question of some political mistakes. Though the media always publicize the number of deaths, which is rising to about 400,000, really we consider high, but we have rescued more than 30 million people. We have treated about 30 million people recovering from COVID-19 in Brazil. So the situation is a mixture of poverty, economic poverty, and mismanagement. Taking this away, I think it's very beautiful to live in Brazil.
Absolutely. I think it's good that at least you give us some cheery news as to the recoveries, but still staying with those figures, is there some sort of explanation? Do we know why those cases keep coming in their thousands? Because when you look at it, Brazil's population is similar to Nigeria's at over 200 million. In fact, Sao Paulo, for example, the population is 20 million, just like Lagos, but there is no similarity whatsoever in the COVID figure. So is there any insight, any new insight as to why these cases keep coming in droves?
As I said earlier, we have some amount of problems. So science is being politicized in Brazil so much that the mayors are wrongly taken. Most of the leaders, I mean the political leaders, they take their individual intuition. They don't have any central organization to direct the programs. You have the state governors, you have the municipal mayors, each person going on his own way. And definitely these mayors are really not. So I think the political mistakes are the main causes of this tragedy in Brazil.
I think you're trying to refer to maybe what we have in Nigeria, where there was a presidential task force and now a presidential steering committee. I think you say that that is not the case in Brazil. But this brings me to my next question. There's a lot of talk around the president's handling of the pandemic. In fact, we hear that Congress has launched an inquiry into this. Is there a solution first at the leadership level before we get to the followership? Because clearly, like you said, it seems the leaders are just doing things the way they seem right.
Please, can you repeat the question again?
Okay. Pardon, I know that the connection is a bit sketchy, but I'm focusing on the talk around leadership. I try to, compare what we have in Nigeria, where there's a presidential steering committee. You say that there's nothing of such in Brazil. So is there a solution? Because if you say that's where the challenge is there some sort of solution in light for that particular challenge of leadership?
It's very, very difficult. And I think Brazil is so similar to Nigeria in terms of political practices. The question is that we have the parties, everybody is interested in his own game. We have the Minister of Health that has been doing a lot of things, but unfortunately we have some sabotage on the other end. So the corruption is rampant. Like we are talking of vaccine right now. Some local governments, they are not distributing to the population. Some are selling it, or some nurses are how can I call it? Misapplicating the vaccines. So it's a very complicated country, but the solution is coming because Brazilians are so good in mobilization. The population is, is watching their leaders and they are charging them responsibilities. I think in some few months, Brazil will overcome this problem, definitely.
That's our desire and prayers for you as well. But we'd like to thank you so much, Dr. Emmanuel Oluwatoyi, a Nigerian physician in Brazil. Thank you for your time on the program, and we wish you the very best.
Thank you very much for giving me the opportunity. Send me well to my people at home.
Well, I'm sure they can hear you. Speaking of back here at home, we're now being joined by Dr. Oladapo Ashinobi. We tried to get him on phone, but now he's right here with us in the studio just to discuss some of the recent trends we have seen in the country. Good to have you, by the way.
Thank you.
Thank you for wading through the traffic just to get here. Now, talking about where we are now in Nigeria, we just took a look at what's happening in Brazil. Clearly, that's far from what we have in Nigeria, but there's still a lot of concern here in Nigeria. Seeing the cases have been dropping in recent times, there have been a lot of reasons to that. But what do you think? Do you think it's as a result of something we're getting right, or this is just a normal phase in the life of the pandemic?
Well, it's a mixture of many things. One, thank God we have a structure of leadership and governance that is leading this pandemic. I mean, to a large extent.
Yeah.
They are taking the right measures, giving the proper health advisory. The citizens are getting the correct information. However, the only challenge is the way people perceive things. People do not feel that they are at high risk of getting COVID because they're not seeing a lot of people die of COVID. And they cannot see a lot of people die of COVID if many people are not doing the tests. So some people would have died and would have called it brief illness because COVID usually affects the elderly who, by our culture, if they die, we celebrate. Also, it also affects people with previous illnesses who may likely have a higher chance of dying. And so it won't be a new thing if somebody who has a chronic illness dies. Because the person has not done a test, we cannot say it's a COVID COVID death. So the best we can do is work with the figures we have. And I don't want Nigerians to go and have a false sense of security that the Indians had. Two things they thought was going for them was that, one, we're a country where we're taking the right measures because they were doing a lot of tests. We're a country where we have one of the biggest manufacturers of COVID vaccine. And so we cannot afford to be careless. In the last 3 months, January and like 2 weeks ago, they had two of the biggest Hindu festivals where over 1 million people gathered in each. So if COVID had a 10% infection rate, that means at those events alone, about 200,000 people. And it spreads very fast.
Yeah.
Now, add that to the fact that there are new strains that actually spreads faster than the original strain. Then it tells you where the challenge of Brazil came from.
It's just, I mean, it's quite interesting. So
Yeah.
the picture you're painting now is that there might still be a lot of challenges ahead for the nation. A lot of things will have to combat. So it brings me to this next point. It is said prevention is said to be better than cure. It is also said that prevention is cheaper than cure. The NCDC had recently said that, you know what, we need to ensure that we make preparations, which is cheaper than actually fighting it. We're in the battle. So in terms of strategy, preparing for the inevitable, which they say is a third wave, where should we be focusing our attention right now?
Well, we should ramp up testing because that is the gold mine of understanding how well your epidemic is moving. It's the number of people who test that will give you an idea of the pandemic you're managing. However, if that is not there, the next best assumption is to use results of surveys. NCDC and Nigerian Institute of Medical Research did a survey earlier this year, and they found out in Lagos, the people who had COVID in their blood, even though they didn't do an official COVID test, it's a community survey, were 1 out of 4. And in the 3 other states, 1 out of 10. So if you take an average of that and stay with the lowest figure, we'll be saying Nigeria has a COVID infection rate of 10%. If we have a 10% infection rate, that means knowingly or unknowingly, we might be having 20 million people having COVID. Yes. And if that is it, if you look at the death rate of COVID, it's usually between 1 to 3% of those who are positive. 1% of 20 million is like 200,000. So we might be sitting on a gunpowder of 200,000 unknown deaths.
Wow.
Just because we are not doing so. If I was planning, if I was going to advise, I would say, please walk in that light. Assume that you're only seeing about 2,000 deaths, but another 198,000 is below the surface. And people say, well, this person died of brief illness.
A job of work clearly on our hands. But Dr. Oladapo Ashimbi, I'd like to thank you so much for at least sparing time to share your thoughts with us.
Yeah. Good luck and keep safe, Nigerians.
Oh, you heard it from the doctor. Outside the country, again, the European Commission is not backing down in its quest to get legal redress against AstraZeneca over vaccine deliveries as its lawsuit against the drug company began at a Brussels court. The case is the latest twist in an EU dispute with the Anglo-Swedish drug maker and at times with Britain, as the bloc accuses the company of failure to respect its contract. With the pandemic still raging across the continent, the AstraZeneca vaccine was seen as a central part of Europe's immunization campaign and a way to send coronavirus jabs to poorer countries because of its easier storage requirements. Well, a lawyer for the EU Executive Commission told Brussels court hearing that the bloc was seeking immediate deliveries from all factories listed in its contract, including those in Britain, which is no longer a member of the EU. Meanwhile, a lawyer representing AstraZeneca told the hearing, which is public and is being conducted under an emergency procedure, that the company contract did not include an obligation to deliver vaccines from all production plants. But don't forget to protect yourself. The virus is still very much out there. So continue to take responsibility and visit our website, channelstv.com, for more updates and a better understanding of the pandemic, plus so much more. Well, that's the COVID-19 update for today. Thank you for watching. I'm Kayode Okikio.